Hello everyone. I am drberkkkaratas. We will talk about erection medicines. Now, of course, when I talk about erection medicines, I will not talk about medicines one by one. Here there are some social situations that we experience among the people in general. There are a number of things about the doses of medicines, such as which is better, which is better, which is sold here, which is sold here. I'll tell you a little bit about them. So we're going to have a talk about quasi-medicine, our scientific studies. These are the ones that we benefit from. Now, as you know, no one uses these medicines, but 15 to 16 billion copies are printed annually, but no one uses them. If you ask, I encounter this a lot. The first thing I asked was, do you use medicines for erection? No, he says I didn't use it. And then I say, your friend gave me something like that. Oh yes, he once gave it to me and so on. The second question always comes up for some reason. Now there's a name issue with these medicines, there's a dose issue, there's also a history of side effects. Let me briefly talk about them. Now we have 4 active ingredients: sildenafil, tadalafil, vardenafil, avanafil, so this is also new. Therefore, there is no other active ingredient other than this. But of course, there are many commercial products in the face of the same content of this active ingredient. So it depends on the countries. For example, a Medinas trade name that is in Turkey does not exist in Germany. What happens in Germany does not exist in Turkey. Because everyone produces in their own way. But the active ingredients, there are these 4 active ingredients. There is no other active ingredient either. Of course, it would be best to use the idea or decision of which of these active ingredients to take or which one to use, and to use the doctor you go to. Which one to use belongs to the doctor. Of course, the dose event is important. Of course, the doctor will determine the appropriate dose here, but my advice to you here is your doctor, which medinas to use, at what dose, how often to use it. Do not forget that your friend, your spouse, your friend, the herbalist, the seller in the petrol office, the seller in the market are not your friends. We are your interlocutor here. Now the dose event is important. For example, I hear this a lot. They say you use 20 milligrams, I use 100. You use it less than I do. Different active ingredients have different doses. We can't compare them. In other words, 20 milligrams is the highest dose in the active ingredient A, for example, in tadalafil. In the sildenafil group, 100 milligrams is the highest dose. We cannot compare them, nor can we say that you are getting more from me, you are getting less from me. Please do not make such a comparison. Another situation here is that it is a big problem to take medicines by dividing doses. Keep in mind that if the medicines do not have a notch on a pill, that pill cannot be divided. What does it mean? You have a 100 milligrams medinas, if there is no notch in the middle, when you cut it in half, it will not be 50 to 50, it will not be homogeneously distributed because there is no notch. Sometimes you get 80, sometimes you get 20, sometimes you get 30, sometimes you don't get any. And then it goes something like this, and patients say, and that's something that we see all too often. I take the medinas, sometimes it is effective, sometimes it is not effective at all. Now, if you don't come across someone who is interested in this business, he says, oh, if the medinas is not effective, then let's do Doppler, let's see if there is a leak, this job will go on and on. But if the question of whether your medicine is notched or not, if it is notched, this will not work anyway. But in notched medicines, there are 2 notches in some of that notch, and you can break a single notch in others. Do these medicines have advantages over each other? No. So far, there is no study that evaluates all of them together, made on one person. They all have different characteristics. Some should be taken earlier, 3 to 4 hours before longer acting. Some of them need to be taken in a shorter time, shorter acting. Some have a slightly higher initial dose. Some have less. Some of them have some side effects. Some of them have few side effects. Of course, the person who will decide this is your doctor. Therefore, let's use it on the doctor's advice. And there's this thing, he took the medinas, he got on the woman, or he got on the woman, he got on top of her, he had a heart and died. There are such stories. These are stories. Scientifically, there is no such data. Moreover, the risk of heart-related damage does not increase due to the medications prescribed by the doctors, that is, the person who listens to you and examines you. So you don't have a problem with heart disease. But, of course, you go and buy it yourself, and there are pastes and so on. They all have medicine in them, but when you take a spoonful, you don't know how many mg you're taking. If you already have a heart condition, and if you are taking 200 mg from there, not 100, then you may have problems, but there is no fault of the medicinus here. The fault is that you consulted the doctor, that is, you did not take the appropriate dose in terms of dose. The most important issue about these medications is that people with heart rhythm disorders should not use these medications. That's the only thing we don't use here. There are a number of nitrates related to these. There are medications used sublingually, so keep it this way. If you are using a sublingual medicinus, be sure to do something with your doctor before using this medicinus. Because the same thing does not happen with every sublingual medicinus. Therefore, if you are going to use a medicinus related to erection as a result, please get help from any doctor. I repeat, the person you will get help from is not a greengrocer, butcher, petrol office employee, herbalist, etc., your friend, your spouse, your friend. Don't forget. Thank you.